Um, first of all, if you want to know if you need a breast lift versus just a augmentation, after you've been examined and we determine how lax your breasts are, if the breast implant that you decide to use will fill up the breast enough that will bring all the tissues up, and then that would be sufficient. But sometimes the breast is too lax and needs to be lifted in a surgical way, and meaning that we would need to put do some incisions around the areola, and possibly also down from 6 o'clock to the inframammary fold, and we drape or reconfigure the tissues inside the breast, and then we drape the skin over the tissues. If this could be done only with like a donut type shape incision, which is just around the areola.
Donut incision and a lollipop incision. Can you tell me a little bit more about the difference?
Yes, the donut incision is called a circumareolar incision, or a Bellini type mastopexy. What we do is, if the laxity is not that big, we perform an incision around the areola, and then another incision, which is bigger, around the areola, the space, and all that tissue is then repositioned.
The difference between the incisions you explained, and you mentioned that there's a donut and that there's a lollipop.
Mm-hmm. Okay. The circumareolar incision, which is what I was referring to the donut type mastopexy, is, if you could see this diagram here, it would go around the circumference of the areola. All that tissue would be removed, the skin, and then it would redrape back into the areola, making getting the excess tissue out. Okay. If there's too much excess breast, then we would have to do a vertical mastopexy or vertical breast lift, which is the lollipop. The incision would be more in this pattern, where the excess tissue is removed. The excess breast tissue inside the breast is also removed, and the breast tissue inside is